Hello everyone, I'm Dr. Motahare and welcome back to the Art of Medicine. Today we will diving into one of the most common autoimmune disorders, rheumatoid arthritis. I will talk about all things related to this disorder. By the end of this session, I hope that we can have a complete understanding about this disorder and also knowing that how the early diagnosis and treatment can make some life-changing effects. Let's get started. Rheumatoid arthritis is a chronic disease where the body immune system attacks the joints by mistake. That's why it's called autoimmune. We have lots of autoimmune disorders that the body immune system, which usually every time just help us to prevent from lots of infectious disease, cancer disease, many things, now just get a little confused and just attack its own cells, healthy cells. These attacks mainly involve the joints in rheumatoid arthritis and leads to inflammation, pain, swelling, and stiffness. If not treated by the time, it can lead to joint damage, deformity, and even it can attack the other organs after joint. Okay? Rheumatoid arthritis affects half 1% of world population. Women are 2 to 3 times more prone to this disorder than men. And it starts usually between 30 and 60. The main risk factors are being female, older age, a family history of arthritic rheumatitis, and also smoking. Other risk factors involve environmental exposure, like occupational dusts or air pollution, or possibly periodontitis. Modified risk factors like obesity and certain dietary pattern like high in red meat and low in omega-3 also linked to increased risk of RA. But none of them are very good established. They are just playing a role. It means that this disorder, like many others, is a multifactorial problem, a combination of genetic susceptibility and also environmental exposures. So we just list the things that can trigger this problem in a person who is prone to this disorder. Otherwise, there are lots of people around the world who are obese or who are smoking and many things like that, and they don't have rheumatoid arthritis. The body immune system mistakenly makes some antibodies like rheumatoid factor and anti-CCP that attacks the joint. This leads to inflammation, weakening of the joint lining, and also eventually joint destruction if left untreated. It's like many other autoimmune disorders that the body system produce some antibodies that attack some proteins which are specific for different parts of body, and the body just destroy itself. That's why it's called autoimmune disorder. Rheumatoid arthritis can be clinically classified as seropositive and seronegative. In seropositive rheumatoid arthritis, some blood tests like rheumatoid factor and anti-CCP are positive. This type is more aggressive and causes more severe problems. In seronegative RA, these tests are negative. But this type is not that much aggressive, but it still can cause joint damages. There are other types too, like Felty syndrome or juvenile arthritis, but the most common type that we're talking about today is adult onset rheumatoid arthritis. About the symptoms, RA usually causes pain and swelling and stiffness in multiple joints, especially small joints in the hand and wrist. This one and this one. This joint and this joint, especially in these two. And also it's symmetrical. It means that both sides are affected. It's a hallmark for this disorder that both sides are affected, left and right. And it also causes some kind of a stiffness that is worst in the morning. This is another important point, that this stiffness usually lasts more than 30 minutes in the morning. Most of us, when we are just wake up in the morning, we feel some kind of stiffness in our bodies, some pain, stiffness, but it will be resolved in less than 30 minutes when it's not rheumatoid arthritis. But when there is an autoimmune disorder, this stiffness will not be released easily. It takes more than 30 minutes to 1 hour. It's also an important point. Beyond joints, RA can also cause fatigue, low-grade fever, and also weight loss. It can also affect other organs like eye, lung, and heart. Diagnosis of RA is based on symptoms, physical exam, blood test, and imaging. Important blood tests here are some factors like rheumatoid arthritis and anti-CCP, and also other markers of inflammation that reveal that there is some kind of inflammation in the body, like ESR and CRP. Imaging studies such as X-ray, ultrasound, and MRI can show us the pattern of joint damage and also inflammation. Clinical judgment is very important. We should just gather all information together and then jump to a diagnosis. The main goal of treatment is to control inflammation, protect joints, and increase the quality of life. Maybe this problem is not going to be cured, but we can manage it. We can minimize the damages. There are multiple choices, multiple drugs that doctors use, and based on the patient's general health and also condition, they decide which drug they should use or they should not use. The doctors adjust treatment until the disease is well controlled, ideally remission or very low activity. But patients should always get a complete checkup to be sure that the disease is under the control. Medication is just part of the story when it comes to managing rheumatoid arthritis. Lifestyle changes and supportive care play a huge role in keeping patients healthy. First, exercise is very important. Even there is pain and stiffness, gentle regular movement helps maintaining joint flexibility and prevent muscle wasting, muscle weakness. Physical therapy is also very helpful. They can teach the patient some safe exercises and ways to protect the joints during daily activities. Occupational therapy helps patients adapt their home or work environment, making everyday tasks easier and even less stressful during the day. Smoking cessation is very important. Smoking not only increases the risk of developing RA, but also makes the disease harder to control Stopping smoking improve both RA outcome and also overall health. We also focus on vaccination because some drugs that we are using for treatments of rheumatoid arthritis just weaken the immune system. So we should be protected against some infections like flu and pneumonia. So vaccination is advised before starting the treatment to reduce the risk of future infections. Another key area is bone protection. Patients with rheumatoid arthritis, especially those who are taking a steroid, at higher risk of osteoporosis. Doctors may suggest vitamin D, calcium, and also other bone protective medication. Finally, RA isn't just about the joint. It raises the risk of heart disease, so managing cardiovascular health is crucial. What does that mean? It means that we should control the blood pressure, cholesterol, maintaining a healthy weight, and staying physically active. Altogether, non-pharmacological care is just as important as medication. A team approach involving doctors, therapists, and lifestyle changes gives the patients the best chance to living well with rheumatoid arthritis. And also stress management is very important. Like many other autoimmune disorders, when there is a stress, the severe stress, the disease will be exacerbated. So we should find a way to manage the level of stress in our lives. The outlook of rheumatoid arthritis has improved dramatically in the recent years. With early diagnosis and effective modern therapies, many patients reach remission or maintain low disease activity. However, certain factors like delayed treatment, smoking, and having strong antibody positivity can make the disease more aggressive. The good news is that with today's therapies, most patients are able to live active and fulfilling lives. To sum up, rheumatoid arthritis is a chronic autoimmune disorder affecting mainly the joints, but it can also affect the other organs, including heart. Early recognition and treatment is key to prevent permanent damages. A multidisciplinary approach, a combination of medicine, lifestyle changes, and supportive care makes the best outcome possible. And also, especially care about your emotional health, your stress level that can exacerbate the situation so badly. Thank you for watching. If you found this video helpful, please like it and subscribe to the channel. Stay informed, stay healthy. Thank you.